Hi everyone. So we're going to move on to the second part of topic 1.3, which would be the barriers, because I didn't get it right last time. So barriers in therapeutic relationships. We have two types. Professionally centered barriers, so barriers that we have, or client-centered barriers. Both very important. So professional centered barriers are easy reassurance, minimizing feelings, approving or disapproving, agreeing, disagreeing, giving advice, prying, becoming defensive, demanding the client to explain their behavior, or making commonplace or cliched comments. So easy reassurance. Client has the right to feel how they feel. It's not for us to say, oh, everything will be okay. Don't worry. That's giving false hope. It doesn't do any good. Minimizing the patient's feelings, not taking the client's feelings seriously. Instead, use attentive listening and empathy to open up communication channels. Their feelings are real to them. Approving or disapproving. Approval may make the client think they will be rewarded. Disapproval may make them feel like moral judgment against them. So be very, very careful. Agreeing and disagreeing turns patients' health to a matter of right and wrong. Remember, it's autonomy. They have the right to make their own decisions. Giving your own advice. Your thoughts and needs are not your client's thoughts and needs. What if you're wrong? They may blame you in the end if whatever you decided turns out wrong. Prying. This is when we ask those pointed questions, right? The client has made it abundantly clear they don't want to wish to talk about something. Don't force them. They are in charge. Becoming defensive. And all of us become defensive when we're attacked. But in doing so with a client, you've got to be the bigger person. Take the moral high ground. Otherwise, the therapeutic process breaks down. So show empathetic listening and attempt to address issue. Find out the reasoning behind the attack. Demanding that the client explain their behaviors. They may not know why they did something. Client no longer feels free to communicate. Again, they feel like they're on trial. Don't be so pointed with your questions. Making commonplace or cliched comments. I hate this when people do this because it's just like you're disregarding their feelings. Like you're not listening. You're not engaged. Be very careful. So now that was professional. So now client-centered behavior barriers. Compensation, denial, displacement, dissociation, identification, projection, rationalization, regression, and repression. So compensation overemphasizes the good to make up for the bad. Patients almost always don't always tell you the exact truth. Denial, rejecting what exists. They just deny it. It's not happening. My blood sugar is not 25. It's not happening. I'm okay. Let me just change it here. Displacement. Does not accept ownership of thoughts and feelings. Puts them on someone else. Hopefully that doesn't happen too often. Dissociation, emotionally disconnected, often can include things like daydreaming or zoning out. We all do it. Or doing things on autopilot. The individual may feel surreal or disconnected from others. Sometimes in stressful situations, people just go on autopilot and just react. Identification, they believe their own behaviors are inadequate. Therefore, they change them. They take on somebody else's behaviors. They think they're more acceptable. Projection, accusing someone else of feeling what you're feeling, but won't acknowledge how they're feeling. Not sure why my slides keep going up. Rationalization, false reasoning to justify inappropriate or unacceptable behavior. Believes this makes the behavior tolerable to others. We all rationalize our behavior at some point. Regression, falling into immature behaviors or thoughts. Some people, when they get stressed, or they just regress to past behaviors. A lot of times happens with people with mental health. Children, often if they're in an unfamiliar situation, may regress. Repression, bottling up emotion. They don't want to they don't want to show you what's inside, so they hide it deep inside. So what can we do, though, to reduce the barriers, especially if they're related to anger? Well, learn to recognize anger. We're going to talk more about this later in another unit, but we'll get these out now. Stay calm, stay respectful, stay genuine, be engaged, stay focused on the client's physical and medical needs. Resist the urge to defend yourself when accused. Find out what's at the heart of it. Encourage them to be more specific when describing reasons. Calmly and firmly present your point of view. Never put the client in their place. Keep promises. Give time alone if necessary, and if you feel threatened, leave. You should never put yourself in harm's way. Otherwise, you can't do your job. So what about anxiety? Well, how are we going to break down those anxiety barriers? Well, learn to identify anxiety. Acknowledge it. Acknowledge that the client is feeling anxious. Use appropriate nonverbal communication. Be engaged, be accepting. Identify sources of anxiety. Make the client physically comfortable. Determine supports, like is there somebody you can call to help them. Never minimize the emotion, and build a climate of warmth, acceptance, and trust. Try to help the patient cope, provide truthful information, and make sure the whole healthcare team is notified that the patient is anxious. And this is a typical exam question. So when administering medications to a client with a recent heart attack, the client states, "I don't know why I bother with these. I'm just going to die of another heart attack anyways. What is the best therapeutic response?" So A, you have to take these. You can't just let yourself die. B, you're just feeling a little blue. You'll feel better later. C, tell me more about what you're feeling. D, you have the right to refuse treatment. I can't make you take them. Well, the correct answer is C. You want to find out why they're feeling the way they're feeling. You don't want to minimize it. You don't want to boss them around. You don't want to just accept the fact that they've refused a medication. You want to find out why. Anyway, that is the second part of 1.3. And now on to 1.4.